Have you ever finished using the bathroom, zipped up, started walking away, and then suddenly noticed it? That unexpected drip, a few drops of urine soaking into your underwear, even though you were certain you were done. It's annoying. It's uncomfortable. And, let's face it, it's a bit embarrassing too. But you're far from alone. In fact, this is one of the most frequent complaints I hear in my office. I'm Dr. Sarah Mitchell, an American sexual health and urology specialist. Today, we're going to talk about post-void dribbling, what causes it, why it happens, and, most importantly, how you can stop it. Post-void dribbling, or PVD, is when a small amount of urine leaks right after you've finished urinating. It can occur as you step away from the toilet or even a few minutes afterward. Research shows it affects anywhere from 5% to 58% of men, but in my real-world experience, it's probably even more common, especially in men over 50. There are three main reasons this occurs. The first is something known as urethral narrowing or a stricture. This means there's a tightening or partial blockage somewhere in the urethra, the passage that carries urine from the bladder out through the penis. When that narrowing exists, some urine can get trapped behind it. You'll empty most of your bladder, but a small amount remains stuck. Then, when you move or shift position, gravity and pressure push the rest out. The second cause, and probably the most frequent, is called prostatic urethral trapping. The prostate gland sits just below the bladder and surrounds the urethra. As men get older, the prostate often grows larger. This condition is called benign prostatic hyperplasia, or BPH. When the prostate increases in size, it can press against the urethra, disrupting normal urine flow. You actually have two urinary sphincters, one near the bladder and another below the prostate. Here's what happens. You urinate, the bladder contracts to empty, and the bladder sphincter closes. But if the enlarged prostate is pressing on the urethra, some urine stays behind in the section of the tube below the prostate. When your lower sphincter later relaxes, that leftover urine leaks out. This is extremely common in men over 60, and about 80% of men over 70 have BPH. The third possible cause is weakened pelvic floor muscles. You have two small but important muscles, the bulbocavernosus and ischiocavernosus, that help squeeze out the final drops of urine during urination. If these muscles have weakened from age, lack of activity, or nerve-related conditions, they may not contract as strongly as they should. This leaves just enough urine behind to cause leakage once you're done. Now, let's cover what you can actually do about it. If your urine stream feels weak, if it sprays in multiple directions, or if you need to strain or hesitate before starting, you may have a stricture or an enlarged prostate. In that case, it's important to visit a urologist. We can run simple tests and discuss possible treatments. If you've also been waking up more often at night to urinate, or you notice increased urgency and frequency, that's another sign your prostate may be playing a role. Treating the prostate can often reduce or even stop post-void dribbling. But if leakage is your only symptom, you're probably dealing with a muscular problem, and the good news is there are easy techniques you can try at home. The first is called bulbar urethral massage. Right after you finish urinating, place two fingers gently behind your scrotum at the base of the penis and press lightly, then slide upward while keeping gentle pressure. This helps move out any remaining urine in the urethra. Do this once or twice before zipping up. You can also lightly shake or squeeze the penis to clear the last few drops. These small habits can help a lot. And finally, pelvic floor training, often called Kegel exercises. To locate the correct muscle, imagine you're stopping your urine flow midstream. That's your pelvic floor. Once you've identified it, here's the routine. Squeeze the muscle for 5 seconds, relax for 5 seconds, and repeat this 10 times. Do this 2 or 3 times daily. Just don't actually perform them while urinating. And if you have pelvic pain or discomfort in the testicles, consult a specialist before starting. Bottom line, post-void dribbling is very common, but you don't have to just accept it. Whether it's caused by a urethral stricture, an enlarged prostate, or weak pelvic muscles, there are real, effective solutions. You deserve to feel confident, comfortable, and in control every time you leave the bathroom. If this information helped you, share your thoughts in the comments and let me know what topics you'd like me to cover in the future. I'm Dr. Sarah Mitchell, and I want you to take care of your health because you truly are worth it.